Hi, I am here in the office of Dr. Misbah Khan, waiting to undergo chin and jowl sculpting. I had 2 sessions of Kybella, and as you can see, I still have a lot of neck fullness. So I'm very excited to have my procedure done today, as I will be able to see results immediately.
So we are halfway done with the procedure, and as you can see that there is already a noticeable difference in terms of how the neck is looking right now. As I'm doing the procedure, I'm also talking to my patient. So Cedar, how are you doing? Doing so far okay?
I'm okay.
Good.
It's all numb.
Wonderful. So there's no pain associated with it. That's great. So it's very important to make sure that while you're doing this procedure, that our patient comfort level is maintained throughout, and then also to talk to the patient as you're doing it to make sure that everything you're performing is not affecting their speech or swallowing, and you can see the results as you're going. So as you can see, we are sculpting along the jawline at this point, and I've done sculpting quite a bit of a fat from the front of the neck. As you can see, there's already a noticeable difference from what we started off with. The completion of the procedure on neck and jawline sculpting, as you can see that there is a significant improvement in the angle of the jaw as well as the front of the neck where most of her fullness was. It's very important to maintain a certain angle, and that's called as a cervical mental angle, and that's what we are looking for when we look at a patient from a side. Also understand that there is a little bit of a swelling right now, which will obviously subside over the next couple of days or so. It's important to make sure that towards the end of the procedure you ask the patient to smile. Can you smile for me, please? Can you swallow for me, please? And then, are you in any discomfort at the moment?
No.
So those are important things to ask a patient towards the end of the procedure, especially after doing the jawline, because if there is any problem with the nerves or whatever, then you will be able to assess it at the end of it. So this is the total procedure. Took us less than 30 minutes to perform, and the results are there. These are going to be long lasting as long as the patient maintains her weight and does not necessarily gain way too much weight. Then these results can be almost permanent. So we will ask our patient to come back in about 2 weeks or so, and then we will take the follow-up video and then also a follow-up series of photographs to show the audience exactly how it looks like, comparing the before and the after picture.